one. Thank you. Dr. Aliya was talking about her experience in the camps, and she has some of the slides to share with us. Here you go, Dr. Aliya.
Okay, thank you very much. Now, how will I be able to advance the slides? Will you do that for me, or will I be able to do that? Oh,
Yeah.
okay, got it. All right. All right, so I just wanted to say, approximately 1 million Rohingya people are in the camps at this time. And I wanted to emphasize that many of these, approximately 60% plus, are children who are, or many of whom are orphans and have been severely traumatized. They've seen their own parents being tortured, slaughtered, gang raped, murdered in front of their eyes. And a large number of women and girls were gang raped. Gang rape was used as a weapon of genocide by the Myanmar military. This is what has characterized this genocide. And many of the children and the adults have bullet wounds trying to flee Myanmar. I'm trying to advance the slides. The refugee camps are very crowded. There's no access to clean water, food, or sanitation. It's really a breeding ground for rapid spread of coronavirus. There's no medical care. People are afraid. Right now, they don't have access to phone service or the internet. And they're just waiting for the international community to do something. And the sad reality is that the world is doing nothing. This was from World News, June the 5th, 2020. We now have 29 confirmed cases of coronavirus. They're living in very, very poor conditions with no access to clean water, barely any food, or very poor shelter, very, very poor hygiene. There's open sewage in these areas. And the sad situation is that this was not unexpected. It was in 2015 that the International State Crime Initiative, based at Queen Mary University in London, found evidence that the Rohingya are in the final stages of genocide. And they confirmed, I'm just trying to advance the slide, that their civil rights had been rendered meaningless, their livelihoods were destroyed, and these people were forced into concentration camps. And there was a major campaign of hatred and othering, comparing them to animals, to rodents. And this is typical of the dehumanization that happens in a genocide, where we paint the other people as not being human. And Professor Green wrote that the situation is very serious, very similar to what happened to the Jews in the Holocaust and to Rwanda in the 1990s. And it was in 2017 that we saw this onslaught that happened with the violent attacks, with burning of villages, beheadings, systematic and widespread gang rapes, babies being snatched from their parents' arms and thrown into the fire, and young girls and women being gang raped by soldiers. And these young girls and women, they delivered their babies in the camps in very, very horrific conditions. We had satellite images showing us the destroyed Rohingya villages. The government, of course, denied everything. It was through indirect evidence that we were able to confirm the genocide taking place. Mass graves were identified, again through satellite images showing that entire villages had been burnt, and time-stamped cell phone videos showed the faces of the bodies that had been burnt with acid and blasted by bullets. So horrific, horrific atrocities with wiping out of entire villages. When the world said not again, the world did nothing, and has been very, very slow to respond to a genocide happening in front of our eyes. And again, I'm trying to advance the slides. These are children with third-degree burns, second-degree burns. These babies were thrown into burning huts. and were severely traumatized. As you can see, this little boy, you know, he's got scars all over his face and his skull. Here's a picture of a child with a festering wound from the end of a rifle stabbed into his arm. You know, the atrocities have been unheard of, unbelievable, horrific. 60% of the refugees in the camp are children, many of whom are indeed orphans. And as you can see, these children, they don't have clothes, they have no food, they have no clean water, they've lost their parents, and they're waiting for the world to take action. And the world has been extremely slow, and these images are not on front page news even. There's been a very slow response to this genocide. In 2018, the UNHCR released its report documenting the systematic targeting of civilian Rohingya by the military, the mass gang rapes, the sexual slavery, and the razing of hundreds and hundreds of villages. And it was in September 2018 that Canada recognized the genocide of the Rohingya people, and we stripped the leader's citizenship. And this leader has truly been a disgrace. Her actions have been a disgrace. She has not spoken up for the rights of the Rohingya people. The International Criminal Court of Justice received a lawsuit that was filed by the Gambia, Mr. Tambadou's office, alleging that a genocide against the Rohingya people had taken place and continues to take place. And the International Criminal Court of Justice was asked to protect the people from the actions of the Myanmar military. Myanmar has acknowledged war crimes, but has denied that genocide has taken place. And the International Criminal Court of Justice heard the case in January of 2020, and it was in February of 2020. The slides are really slow. Again, here we go. They stated that Myanmar must take immediate action to protect its extremely vulnerable Rohingya minority. So here we are today. Professor John Packer has recently issued an important statement from the Center for International Policy Studies, June the 3rd, 2020, urging Canada to take action. Again, the slides are very, very slow. Canada is committed clearly to upholding rules-based international law, and Ottawa should join the case of the Gambia versus Myanmar concerning the Rohingya genocide at the International Criminal Court of Justice. And you know, Canada has championed a feminist foreign policy, and we now need to take action. Yes, the victims in this genocide have been men, women, and children, but the genocide has specifically targeted women and girls, and rape has been used as a weapon of war. And Canada is a defender of international human rights. We're a defender of rules-based international law, and now is the time for us to take action. We need to act with other countries and address the state-sponsored genocide and sexual violence against the Rohingya people. And we cannot lose this opportunity to take meaningful action on values which define us as a nation. We have been a leader for global human rights and justice, and we need to take action. And, you know, I join Professor John Packer's statement. Academic physicians across Canada join his statement in urging Canada to take action. We have wasted a lot of time, and now we must take action to save the lives of the people who are suffering in these crowded dilapidated conditions, which are subhuman conditions, and would not be accepted for any refugee camp anywhere in the world. And we cannot sit silently and watch this happening. So with that, I'd like to thank you for your attention. I wanted to say also that, you know, the Prophet Muhammad, peace be upon him, unequivocally condemned racism. And this is racism in its most severe form, where genocide takes place. And in his last sermon in 632 AD, he said, all mankind is descended from Adam and Eve. An Arab has no superiority over a non-Arab, and a non-Arab has no superiority over an Arab. A white person has no superiority over a black person, nor a black person has any superiority over a white person, except by piety and good actions. And so it's important for us to stand up against racism. We're seeing trampling of the human rights of Black people around the world. And we all need to be part of the solution. We all need to say enough is enough. And we all need to stand up against racism and its severest form, genocide. And this is happening, unfortunately, in the world, and the world cannot remain silent. So thank you for your attention.
Thank you so much, Dr. Aliya, and for her very important and insightful deliberations on the facts and figures that he compiled over these years. And our heart becomes more sad as we heard her statements. So now, ladies and gentlemen, let me welcome Khin from United Kingdom, and he would talk about these issues from his perspective. Ladies and gentlemen, Khin.
First of all, thank you very much, Brother Kausar, organizing this event. It's very timely, and especially where we are facing many issues in this world, particularly firstly, we are facing in COVID-19 in the world's largest refugee camp, and also where we are facing Brother George Floyd in the US and around the world. And of course, I'm completely agree what Dr. Aliya mentioned, and it's very powerful presentation, and is very glad to hear from you, and very encouraging to see your presentation on Rohingya issue. And I'm not talking much about COVID, as I supposed to speak on justice and accountability issue. And one thing, what I want to bring out here is most of us here today who are participating, we've been many times to the camp. And one thing, what we heard unitedly from the victims, from the genocide survivors, is we want justice. We want justice. There is no peace without justice. That is what they are expecting. And we've been calling for justice many years, many decades. As you all know, we are facing genocide. Not actually many people are aware after 2017, but it's been going on for many decades systematically. Burmese government and military intentionally destroying our community, which is a genocide. My personal story, I was born and brought up in Arkhana State, western part of Burma. I left when I was about 17. And my grandfather was a member of parliament, and my mother's grandfather was the vast judge in northern Arkhana. I was not recognized as a citizen because of 1982 citizenship law. The laws, Burmese government systematically put it to get away, to strip up our citizenship. Not having that citizenship, we face a restriction of movement, marriage, and education, and other human rights violation, and so on. So what we're looking at when we talk about justice and accountability, we are seeing here now International Court of Justice have taken, there is Gambia file a case at the ICJ. That is, we appreciate and we thanks to the Gambia, the only country. We can see many powerful countries around the world, they talking about Rohingya issue, but we have not seen that much brave enough. They did not take anything, even to join Gambia, we have not seen much yet. The case, the court released, order for provisional measures in January 23rd. So what we can see now is the Burmese government submitted 23rd of May, as far as what we know, they submitted the provisional measures report. Until today, we have not seen what they have submitted. However, we know that as a Rohingya, we have close contact with in our Khin state, and what we are hearing, what we can see the situation there, the ground situation speak themselves, what is really happening, no matter what they submitted the report. But so far, we have not seen that they have implemented anything. Even the situation got much worse. And Rohingya been killed by landmine where Burmese military planted between fighting of Arakan army and Burmese army after 23rd of January, I'm talking about. And many Rohingya have been arrested when they trying to go to other side of Burma, and they released just before to show to the ICJ provisional measures before 2 weeks before of the report. And many Rohingyas restricted to go to the hospital. They cannot go. They cannot get proper education. Still, their policies and laws are still in place, and genocide is ongoing. Unfortunately, we have not seen any countries is pushing for that much support to go along. We appreciate Canada and Netherlands joining Gambia. So for that ICJ case, we really need much more, need to see other countries. This case may go long. And one thing is, this case may go long, and of course, a lot of financial issues and others needed. So Gambia is a small country. We need other countries really need to participate. And this is very important that we have to continue on our advocacy to push other countries to join with the Gambia. And, another case we have seen, ICC, International Criminal Court, that is a deportation case. The case is now a started investigation. We hope some developments, maybe in a few months' time or later. And that is one of the important case we have never seen in ICC. Normally, the case is a different way. This deportation case is very unprecedented case we have seen. So one thing here is, no matter how ICC take this deportation case, Rohingyas and other minorities in Burma facing genocide. Other minorities are facing war crimes and crimes against humanity. When we talk justice, it is important that we are not talking for the Rohingya. Other minorities continuously facing crime against humanity, and they are especially our Rakhine, our sister community, Rakhine brothers and sisters today, they are facing crime against humanity and war crimes, and their daily life. Of course, Rohingyas are facing genocide. In other parts of the Burma, daily atrocity crimes are happening. So many decades, people want to see Burma, minorities, they want to see justice. So that is very important that no matter how ICC case could take in the deportation case, international community must push pressure to in Security Council referral from a situation in Burma. That is very important. We have, of course, ICC have Russia and China, they might be too, but we want to see still other countries should stand up to push that ICC referral is needed, and we want to see individual countries still that will be much better if they can speak up. And the other case is we file a case from Burmese Rohingya Organization UK Argentina, that is universal jurisdiction case, and the case was the same week, the week of justice, what we call November 10 to 15 in November, same week the 3 case file actually ICC, ICJ, and Argentina case. So in Argentina, we submitted the case because of COVID-19. The case takes a bit longer, and recently we heard from the court that the case will go ahead. The case will go ahead. Just need to see whether the case, a universal jurisdiction case in Buenos Aires, is duplicating with ICC case. As far as what we know, that the case is totally different from ICC case. ICC case is deportation case, and universal jurisdiction case in Buenos Aires is war crimes, crimes against humanity, and genocide, and included there not only military, including Daw Aung San Suu Kyi and current government president and former President Thein Sein and President Tenjo. So what I want to point out here is all the cases, we really need international support. We want to see much more universal jurisdiction case. We never know how long will take this ICC case. We never know how long will take ICJ case. So if we respect, as we heard, where, especially why I'm talking about universal jurisdiction cases, ICC case will not investigate what happened to our many brothers and many sisters been raped in sexual violence and raped by Burmese military in Tulatuli, and also many women been raped in Monu village in Butidong, and there are many crimes where Burmese military committed. These need to be investigated. But current ICC deportation case will not investigate Tulatuli, Monu village, and Godupom village, Goduapin village, and others. So we really need to push for other universal jurisdiction case, any other countries, because if otherwise, Burmese military will be continuing in enjoying the impunity. So that is what important, that justice is needed. And currently for ICJ case, come back again, it is important that we need to get that public. We are requesting Security Council members to get it to the Security Council to present the Burma report, and Security Council should take some action. Otherwise, they can go along with anything. And now, Rohingya victims, genocide survivors, our brothers and sisters are talking from the camp. How long will it take to get justice? How many years we need to suffer in a camp? So one thing we should not forget, that no matter these justice cases are going on, we should talk about how restoring full citizenship rights of the Rohingya, how they can return with safety, dignity, and protection in their native land, with returning to their original place. That is very important. And also, international community have to bring forefront line. When we talk about justice, Rohingya voice need to be heard. Where NGOs or other justice and accountability matters or any other issues, Rohingya voice need to be heard. As we are genocide survivors, many thousands of Rohingya have been killed, and we've been destroyed for many years now. So now it is important that to build our community. There are about 1 million around Rohingya genocide survivors. 40% are children. How we can rebuild these genocide survivors? By providing education. And Bangladesh government is not allowing to get education there. So Of course, justice issues will gonna take long, but same time we need to focus how we can build, empower our community, how international community can empower, can promote leaders, can bring Rohingya youth generation, can bring them in forefront line to work for the community. That is very important. And I stop here. Thank you very much.
Thank you very much, Khin, for your very insightful deliberation. And we have heard a lot about the justice issues from Mr. Khin, because he was attending all these sessions personally in many places. So now we move on and we welcome Yasmin Ullah from Vancouver to share her experience and her thoughts on this issue.
Hello, everyone. Thank you very much, Brother Koser, for inviting me to be on this panel and to speak about the issue. I'm very, very honored, and I hope that I'd be able to share something useful for our audience here. Building on to what Brother Khin was speaking about in regards to the current justice mechanism that's already at play in terms of our issues and the initiatives that are being taken by various different nations, including the international courts. What I wanted to talk about is, we've heard enough about how many bodies have been found. We've had a lot of body counts. We've had a lot of accounts of survivors that have come out through various news outlets and different things that we've heard that is so disheartening and so painful to even imagine. It is probably as important for us to learn about the reality that this community cannot just be pitied on, and this community cannot just be viewed as someone in need, someone who needs help at all time, and that international funds have to be poured into the camps or into various different humanitarian efforts in order to salvage a group of people. We have had, a previously successful, development, and we have our own cultural identity. We've had a lot of things that the world have yet to discover because of this, whole situation of us being inflicted with systematic oppression and genocide. And so we are now just being labeled as refugees and nothing else, and that's not really fair for a group of people who've had a long-standing culture and different appreciation for what they've been through and what they've been able to create. So it is probably a really, really good time for us to take a little bit of time to acknowledge that we were the people who've had a lot of things in the past, just like any other civilization, but it's just that we were terribly hurt by a tyranny, and that's why we're here today, needing the help of the international community and Good Samaritans. Now, with that, I wanted to speak a little bit about the role of the international community and the duty that it has. And I'm generalizing and speaking about this in a broad term, not just on the international community as a government entity, not just the UN, but each of the states on its own individual states, as well as humanitarian groups, NGOs, various efforts that are coming to help the Rohingya, or coming to help developing or to do other works for the Rohingya. Now, there is a need for the international community as a whole to be really, really honest about the covenant that it has signed on, the covenant that it has agreed upon with regards to, the UN Declaration of Human Rights, or the Genocide Convention, or other accountability, legal bills and laws that have been passed and signed on, these were done specifically to prevent the kind of situation that the Rohingya have been through from happening. And that's just one acknowledgement that the international community has to come to terms with. It cannot just run away from responsibility while, you know, millions of people are at risk of recurrent genocide. Some of them are still left inside Rakhine State, and they're still, you know, waiting for a death sentence, basically. Now, there is also a need for us to realize that there's been so many times in the history that we've failed collectively. And so maybe this is, you know, this is one chance that we have in order to correct or to right the wrong, without actually taking into consideration the situation of COVID-19 that's already, I would term it a nightmare within the camp situation. It's just, I'm pretty sure that Jessica will have a lot more insights into the entire situation, but without, you know, keeping that in mind or hoping that we're going to be able to move on from it and eventually, you know, the refugee population will be protected from it, and we would be able to think about other things rather than this. There will be a lot of fallouts, you know, from this situation, regardless. And since all the efforts that have been made so far have always been reactionary, the only way forward, I think, is for us to not just anticipate another crisis. We should think about how, you know, the entire situation or you know, an act of good faith can be, you know, has to be forged in order for us to not just live within the crises after a crisis and then, you know, we move on from one and then we will meet another one. It's really not a possibility for humans to be able to survive through that many crises, you know, without any sort of ramification. And so it is so important for us to be at the front and center, specifically the refugees, specifically the survivors within various communities in Bangladesh, in Burma, in Malaysia, in various different countries where their livelihood are very, very restricted. And there are many different levels of threats that they're facing on a daily basis. Now, it needs to include them, and they have to be at the table at all time, because this is the things that affect them the most. They need to have the ability to decide on things that are going to directly affect their livelihood, the possibility of them, you know, living a better life. And so that's one thing that the international community really, really need to keep in mind. Anything else apart from this will always be futile. And we will end up here over and over again where we anticipate something horrible happening, just like the COVID-19 situation, where we've been talking about it for the past 2 months, in terms of the, you know, activists and advocates and various different humanitarian groups, but nothing had prevented it from happening. You know, there are essential services that have been cut by 80% inside the camps right now. People are dying of hunger and shortage of water more than people are dying from COVID-19. And there is this response by, you know, various different governments around the world that had imposed lockdown, had imposed social distancing. It does not work inside the camps. It does not take into consideration the kind of reality that's on the ground. And that's just one thing that the international community, humanitarian efforts, all of it should really collectively think about what is the best practice and how to manage the situation, or how to, you know, anticipate a crisis happening with proper tools, not just copying the coping mechanism that are around, you know, available around the world, because it does not work in this circumstance. The other thing is that you know, education for the people at the camps, for various, you know, refugee communities, and capacity building, or the at least the willingness for us to be able to move forward from the narrative of us just being confined within the word of refugee, needing help, needing, you know, support, needing food, needing water. That's not enough for us to be able to move on from, you know, from being able, from just being, you know, label, from the next label, which is, you know, we've seen the boat crisis, the boat people, this, that, and it just does not help us to be able to push them towards the right direction or push them for to flourish. And this brings me into, you know, another point that I would like to make, is that the investment into the community, into the refugee community, into the population itself, will have to be more, you know, perceptive of what the community has in terms of potential. And it shouldn't just be left within, you know, the very confined or restricted narrative that is very, very negative in terms of the connotation, like refugees or people in need or poor people. You know, there's so many things that are around, you know, the internet, just like it's something called misery porn, which is, you know, showing pictures of people with no clothes, showing pictures of people with no food, no water, something along that line, in shabby situation, and then, you know, collecting funds. Those are great, but it's not enough for us to be able to be accepted in a larger, you know, context of the world. After a while, after, you know, this whole almost this interest within the community, within the issues of the Rohingya, will dry up, and we don't want for that to happen, because eventually the aids or funds that come in will also dry up, and it will, you know, pose a real threat now to sustain the refugees, especially the ones in Bangladesh, and to actually be able to move on from this, we really need to change the perception of who Rohingya are, not just, you know, not just as refugees, as I said. These are sometimes can really be degrading, because there's already a lot of tension within, you know, the host community, within the local community in and around the refugee camps. We've seen something, you know, some hate op-eds and various different rhetoric that are happening in Malaysia as well. Those kind of things will always happen when you know, a group of human is labeled needing help. That's what I've seen in Thailand growing up there. People do not believe that Rohingya actually have the capacity to be able to rebuild themselves, to be able to flourish, to be able to contribute to the society. My parents worked really, really hard when they were, you know, illegal, when they didn't have any paperwork, when they were refugees in Thailand. They worked really hard to send us to school. They worked really hard. We never relied on anybody, but that kind of narratives, that kind of stories are never told. We're told of stories of people surviving, you know, bleeding, battered, and brutally killed. Those are not enough to just sustain the efforts that we're seeing now, because the next, you know, crisis is going to happen, and that's just the reality in the world. We are, you know, in this day and age, although there are a lot of blessings within technology, it also really, really allow people to be able to move on to the next crisis, to the next, you know, bad things that are happening, and people are going to react to it, and then forget about the, you know, the previous ones, or the ones that are still happening. One thing that I want to highlight is that how we can change the perception of the Rohingya, or who they are, is that we really need to look at the camps. And fortunately, I was able to travel to the camps just before the lockdown, at the end of at the end of February, just before everything, you know, kind of shuts down. And one thing was, there's so many civil society groups led by Rohingya, and are strongly working to advocate for accountability measures to be taken. They're advocating for their voices to be heard. They are present in any kind of meeting that allow them to be participants. For example, there was a representative from the foreign from the office, I think from the ASEAN office, and a delegation came from Myanmar, speaking to them about the process of repatriation. And they were there to stand their ground and tell the Myanmar representatives that if their needs are not met, if their demands are not met, if there is no guarantee of their safety and their livelihood within Myanmar, they're not going to go back, regardless of how terribly hard it is inside the refugee camps. And that's something that I think the international community and all of us really need to understand. They're not voiceless. They're not people who need help in order for others to talk on their behalf. We need to be an ally and amplify their voices, allow their leadership to flourish, and really listen to them. This is one of the things that I think would be great if we can see this happening more and more post COVID-19 world. The other thing is, one of the things that I was really, really impressed by was there were so many different groups as well who are working as, they're providing services as a welfare network. And some of these groups are doing a blood drive, whereas because the healthcare facilities within the camps do not have the ability to keep the blood or have people donate and keep it for a long time or have the equipments that are necessary. And they are able to, get people into different care facilities, hundreds of them that are around the camps, and, get each other into places, even though they have to pay out of their own pockets, through to transport and whatnot. And they're able to do those things. They're able to try and help some of the more vulnerable members of the community, like the elderly people or the people with disability, in order for them to fix their roof or for them to do their chores. These are the things that they're already doing, and we don't see enough support. That's one thing that the civil society group members have told me when I met with them, is that we don't have money coming from a lot of resources. There are a lot of money, millions, hundreds of millions that are coming from Canada, coming from the US, coming from the UK, and many other countries that have contributed. But very, very few of those actually go into helping people, taking their leadership, taking their roles in improving their own community, knowing what the issues are. Most of the money, most of the funds would go directly to humanitarian aid groups and paying salaries of people, high salaries of people. And it's just boggles my mind. There are so many Rohingya frontline workers that are getting paid terribly, terribly low wages. They're able to do those kind of work, translating, being a healthcare worker, doing all kinds of work, doing the actual hard work, doing all the legwork, and are not getting paid enough. That's one other issues, yeah. But this is one thing that the donors really need to take into account, is that a lot of the funds that we provide or donate will not go directly to empower people, to really allow them to flourish, allow them to be able to do the work that is needed within the community through the community workers themselves. My last point is that I would also love to see that, I think that it is time for the world to truly acknowledge and value our lives as human. And it sounds so vague. It sounds so, it sounds really, really hard to perceive, but it's important for us not to be subjected to any less treatment, respect, or love just because of our title, of our label. It is so important for us to be invested on, for the community, for the international community to really, really be ready to invest into rebuilding of our community. We have gone through a terribly hard times for the past few decades, but there are so many people who are in the diaspora that are able to flourish. A lot of the young children who actually left from the camps to various different countries are now in university. having really, really good grades. Those are really like a very small example of how investing into the community can really turn the table. It could really turn a new leaf for us. We are not even the best representative of our community. And I moved to Canada when I was 19. It was 2011. I barely knew English. This is just, there's so many smarter, more talented people in the camps that really, really need your help. And it could be just $1 would make so much difference in their work and in their advocacy for their own people. And so with that, I really, really hope that the international community moving forward would really listen to the survivors and include us all in the conversation that's concerning us, and not just include us when it's convenient to, but really, really try and invest in the potential, not just what they see, but really what we could achieve as a community together, so that we don't just stay a burden of somebody. We really can slowly turn into someone who can actually contribute and no longer reliant on the help of the international community. Thank you.
Thank you very much, Yasmin, for her brilliant presentation. And this is so important, Yasmin's core points, which I would also add in the end of or during the Q&A session, because the inherent dignity of Rohingyas as human beings is gradually diminishing. My 2 months of fieldwork for this book project, that's what I personally realized. And it's so important for international communities to understand Yasmin's message that she's trying to convey today, that this is not good for managing crisis after crisis. That is not going to end, and something must be credibly done to restore the the human dignity of this whole ethnocultural community itself. Thank you, Yasmin. Ladies and gentlemen, let's welcome Jessica Olney from California, and she has worked quite a bit in this community for last couple of years, and let's see and let's share her experience. Jessica, floor is yours.
Thank you. Yeah, well, I think, my colleagues Khin and Yasmin Ullah have said it much better than I could. But I have been working closely with some of the civil society networks that Yasmin mentioned, and the very resilient youth and community members in the camps. And so I really echo the point that they can do a lot more. They can be engaged more closely. And I think COVID really brings these issues of inclusion and community representation to a head, because the newly arrived population of over 700,000 people who fled to the camps 3 years ago, they've been there 3 years now, and that was 3 years when I believe rehabilitation activities could have been taking place. Kids could have kind of gotten stable and back in school. People could have been supported, and humanitarian funding could have been directed to support people to pursue livelihoods inside the camps, developing industry and vocational opportunities inside the camp, education for kids, and social support services to help people just get back on their feet while they're, displaced. But because of a lot of kind of, internal politics and maybe short-sightedness on the part of humanitarian and policymakers, none of that's really happened, and it's been more of a holding pattern where this situation is treated as very temporary. The conditions are what you would maybe expect for people who are just going to be displaced for a very short time. But as the situation drags on, we see the need for a longer-term approach. So, COVID has kind of paused the conversation on how to transition from emergency life-saving support into a longer rehabilitation and community development process. So hopefully there will be more space for that whenever we kind of make it through COVID. But of course, everyone is so focused on this disaster and this emergency that it's really hard to even imagine what things will look like in terms of support for refugees on the other side of COVID. one of the things we have to think about is also the situation of host communities. This is Cox's Bazar, where the refugees are living, is one of the less developed parts of Bangladesh. There are high rates of poverty there and lack of opportunities for locals. So services that are rolled out for the Rohingya community living in the camps, have to be done in parallel with services for the host community. And, this will also help strengthen social cohesion between the two communities while the Rohingya are living in Bangladesh. So because of this, need to keep things balanced and provide opportunities for everyone, I think it kind of slows down the policy development side of allowing more livelihood opportunities and education and things like that for Rohingya. And then COVID comes along, and a lot of the international humanitarian workers are no longer in the camp. There are even some, international humanitarian workers who are in Cox's Bazar and have been there during the whole lockdown for a few months now, but haven't been able to go into the camp hardly at all. So what you have left is the communities themselves, you have the locals with rather high rates of COVID transmission now, and then in the camps, presumably also COVID is spreading quite rapidly. And, I think this event really goes to show that things can happen at any time that leave a community to its own devices, leave a community to support itself. And they could have been sort of getting prepared and training and support to lead the response over the last 3 years, but that hasn't happened. So yeah, we do have these civil society networks that are increasingly active in trying to respond to COVID in the community, but they haven't been invested in. They haven't been prepared to take leadership. And so now you have a vacuum because humanitarian services have dwindled, yet community leadership hasn't been supported yet and equipped to kind of take hold and take more responsibility. And then you also have ongoing livelihood issues, which I fear will only become worse with COVID. Globally, the World Bank projects that global remittances will decline dramatically because of the, global economic kind of depression that accompanies COVID. And we don't quite know the ramifications of it yet. But for example, Bangladesh's main two sources of GDP are the garment sector and foreign remittances. Actually, a lot of Rohingya also receive remittances in the camp. We've done a study about this. It's maybe about over 20% of families that do receive a remittance. And for a lot of those families, that's a really important source of income. Will they still have access to that? We don't know. So COVID could affect livelihoods in the camp in really drastic ways. And as long as there's this external dependency, I think people will continue to languish. And when you talk to people in the camps, it's families everywhere, like fathers want to be breadwinners, people want the opportunity to provide for their children. And I think it's such a basic element of human dignity, that need to provide your own family's livelihood. And that could be done in a way that fosters, local economic development in the region, that supports the Bangladesh economy. And I think too often people fall into like a zero-sum game mentality. But I really think that there can be win-win solutions in terms of providing livelihood and rehabilitation and opportunities for resilience to Rohingya in Bangladesh in ways that are also stabilizing and supportive of Bangladesh. And I think you've seen this in some other refugee contexts, that can happen. And whenever we're through the COVID emergency, I would just hope to see like progress on the policy front in that regard. Because the fact is that, Myanmar is on trial for genocide. I mean, the situation is still really bad in Rakhine State. I personally think that we can assume some people will repatriate at some point, even without rights and justice, but this shouldn't be seen as a success or the end of the problem. This should actually be seen as a major failing. If people go back without security, rights, dignity, the cycle just continues and perpetuates. And that's not in Bangladesh's interest either. So I think that, the need for sustainable rights-based solutions, it's unavoidable. And the international community, is not doing nearly enough. Bangladesh has shouldered the lion's share of the burden, far beyond what is fair. I think that we need to be looking at multifaceted solutions. So, repatriation, definitely, this is what people want. We have to support them towards the repatriation that they want with rights, justice, dignity. But also, we may assume that not everyone will get to go back. We have done some research that maybe only a quarter of people in the camps actually still have a close family member in Myanmar. So imagine if all your ties have been cut and you've lost all of your assets there. That's really hard to go back. And when we have mass atrocities, I think the reality is that maybe not everyone goes back. So why isn't there any conversation about, family reunification or third country resettlement? Perhaps it's premature right now, but I think that at some point those conversations have to be had, because we have to look at the family unit. We have 1 million, refugees in the camp, but what that really is 200,000 families. And every one of those families wants a better life for their children. Every one of those families wants to support a livelihood for their family members. And many of them know people in other places. According to our research, it's over 50% of camp households that have a relative either in Myanmar or in a third country. So we need to think about families, restoring family links, keeping people in touch with their families. And I think that will be the way forward if things are to be resolved. So, I think there's no magic bullet. There needs to be progress on many different levels. And when you look at what happened with the Vietnamese boat refugees, between the 1970s and 90s, it took a massive multilateral cooperative effort to move that forward. And countries all over the world it was a point of dignity and pride for countries to say how many refugees they would accept in. My country, the US, accepted many Vietnamese refugees at that time. Where is that multilateral support for the Rohingya? I'm not saying only resettlement, that's necessarily the answer. But, different countries need to make their own commitments and step up and share the burden, and also not see it as a burden. Refugees are not a burden. I'm really proud to live in a diverse, country with people who've been resettled from hardship and been able to rebuild their lives. So more cooperation is really, really necessary. Right now, we can't even get enough multilateral cooperation to deal with the very, very acute boat trafficking crisis that is happening. There's something called the Bali process, which is supposed to be a way for states to come in together and discuss boat trafficking crisis in the region. But even that process isn't working effectively to make sure that people aren't being lost and dying at sea. I mean, this is the most egregious basic level of human rights abuse. And we don't even have the cooperation of the international community to make sure that those absolutely unacceptable things don't happen. Attention gets diverted elsewhere. So, I definitely echo that more international pressure is needed. So right now, of course, it's really difficult to do anything with COVID. Everyone is kind of in a holding pattern, and I think we'll have to see where we are when we get to the other end of that. I can leave it at that for now. But just for me, it's really an honor to work with Rohingya because the resilience and the determination that I find, like with the youth I work with in the camp, it's really incredible. Like considering how much they've been through, and they will make such a great contribution to any community that they're a part of if given the opportunity. And that's the point I want people to really remember. Thanks.
Thank you very much, Jessica, for your again another round of brilliant speech. And in fact, I heard Jessica speaking. I think a year and a half ago in Dhaka University with USAID, if I'm not wrong. So thank you. And she brought a couple of very interesting aspects. So formally, we end our individual discussion here, and I'll open up the Q&A session. And first thing first, I would like to invite Dr. Hilal here, and I will try once again to add Rais from Ottawa. Let's see if he can join us. Mr. Rice, can you hear us? Mr. Rice, can you hear us? Hello?
Yes.
Yes, Rice is on. Floor is yours, Mr. Rice.
That's all right.
Yes. We can hear you. Yeah, please go on. Yeah.
Great. Are we entering Q&A from what I just gathered?
Rice, I think we can't hear you, but we can see you, and with a little bit of.
That's great. So Jessica, wonderful, Tunke, as well as Dr. Aliya, who's not here anymore, and Sister Yasmin, you've covered most of it. I'll just make some brief points regarding a specific topic regarding this topic of the discussion, which is COVID.
Brother Rice, the audio is delayed and is distorted. Can you check your audio, please?
Can you hear me now? Hello?
Yeah. Yeah, it's coming in now. Go ahead.
Can you hear me, Kausabai?
Yeah, I just heard your last part. I mean, last voice. Go ahead. Yeah. Rice, I think you can turn off your video. I think that is creating some issues. Can you, Mr. Rice, can you turn off your video and just speak so that we can get your messages? Mr. Rice, go on. Yeah.
I think I would just touch base with a few points to the topic of the discussion, which is I'll shoot is in Myanmar and the other one in Bangladesh, and have some requests for you specifically because of right. So with regards to Myanmar, you have what is on the ground moment. Mashallah, we all are very well versed. Okay.
Brother
All
Rice, we barely can hear you. I think if you can restart your system again, I think that will improve the voice. We just barely hear you. We couldn't. So what I'll suggest, we'll go on with the Q&A session and wait for you to rejoin. And so at this,
is it better at the moment?
It is a little better now. Yeah. Go ahead. Can you try again? Yeah.
Can you hear me better?
Yes, we do now. Rice, no, I think, okay, so what I'll do is...
all right, perfect.
We'll wait.
So with regards to Myanmar, I'm sure that despite, you are all aware that despite what Myanmar has filed with pertaining to its with the provisional measures is all baloney. It's all tens.
Brother Rais, Brother Rais, I was to rejoin
that they are in the, whereas as a matter of fact, just to give an example of there is a report out of, for example, reports that from my communications on the grounds, got continued restrictions on movement of or abilities for testing inside the camps or inside the villages. The risk to go to the way, and in order to go there, they've got to go through checkpoints. Got to go through all these that were always there, and there's no improvement whatsoever with regards to
okay, Mr. Rice will join us later on with these questions, and he will type it as apology for these technical glitches. So we'll go on with our Q&A session, and Dr. Hilal would join from Bangladesh, and he's working on there. So my first question as a moderator today, first to Mr. Khin, is about one of the aspects that during my own research for the book project, and being a Bangladeshi by birth, I was trying to understand what do you see the future of the whole justice and accountability matter. And I'm also partly reflecting from the session that I attended with you. I mean, I was in attendance, and you were speaker in Columbia University, I think in 2018. So this, how this whole things you see uh, being unfolded. You spoke about universal jurisdiction, Argentina's case very recently. So what do you think? Canada is it lagging behind to push forward with such things? And what do you see other countries joining in pushing the case of justice and accountability? Uh, Mr. Tun, your microphone, unmute the microphone, please.
When we talk about justice, we need to also connect always, as a Rohingya myself, I want to point out here is we need to connect what is the future of Rohingya population, where we have 1 million in camp and 600,000 where their lives are at risk inside Burma. So when we talk about justice, of course, you are asking me what could be, you mean, the last, what can be the solution, you mean, for the justice? Of course, as I mentioned earlier, these justice and accountability issues, it can take quite long. But the problem is Rohingyas are, 1 million Rohingyas are the world largest refugee camp in the world, and how long they can be in a camp? What is their future, where we are talking about 40% are children there, without a growing population, without education? So this is one thing. So I want to point out here, it's gonna take long. Of course, we have to be patient. It's good that we are having one ICJ case, provisional measures report submitted. We do, as far as what we know, that Burmese government, they did not implement any provisional measures. So at the same time, it lies on international community. International community, have to act. We have seen they have not implemented. So is that where we call it now Security Council have to call for, have to get the report to present in Security Council, and what is next, what governments will do if they are not. We can see that they are not listening now. They are not following. They are not implementing. They are not. They are not really following the rules of the ICJ. So what is next? This is very important. Now victims are asking about it. So I believe that it is very important. Governments like who are supporting a Rohingya issue, they have to stop lip service and they have to come for the action. Something much more than ever we need it, because we call for ICJ issues and others, but they have not done anything. So what will be this population, we're growing population without education, and 1 million Rohingyas and 600,000 Rohingya, their lives are at risk, they're still facing genocide. So it lies on international community. Same time, they have to do much more sanction military related and military control companies. That is very important. And we have not seen that many countries are doing it yet. Even we know that some Canadian governments are investing in Burma, which are, so you cannot be double-sided. You have to stand up. You have to be very strong and brave. And US is another side, but unfortunately, administration is really, really unhelpful these days. And we have not seen a state government, even though a State Department, send a group of lawyers and PILPG group release a report. What mentioned to the Rohingyas is genocide, but the State Department is not using it, the term genocide. So the victims want what they suffered. Rohingya really want, that should be called for, but they're not using it. And UK, unfortunately, they supporting humanitarian aid as of US, but humanitarian aid is not an issue. The issue is we want to get a political solution. To get that political solution, really the pressure is needed. So first thing, Rohingya Burmese government have to stop those restrictions and restore full citizenship rights. Instead, they're trying to pushing us to take national verification card, NVC. So that is systematically, permanently, Rohingya become foreigners in Burma. By having that NVC, your son and your grandson cannot be able to participate in election and cannot be a member of parliament, cannot get a job in government side, and cannot go to professional studies. And there are so much restriction. So same as now. So, but firstly, that citizenship, the root cause of the issue, full citizenship need to be restored. International community have to pay pressure. Same time, protection is needed for the long run. And, you know, for the, as I mentioned earlier, for universal jurisdictions, in more countries have to, you know, many more universal jurisdiction cases needed in other countries, then they will be in trouble. And sanctions need to put much more to the military and military-related companies. And Security Council members and others, they have to do something immediately when they are not listening, when they are not following up provisional measures. So those are some points I can say, you know, for the justice and accountability issue. For the long run, of course, as our sister Yasmin mentioned many times, I mentioned to that, building and empowering Rohingya community. And as Burmese government and military is destroying us, we need to counteract, to reveal our community by empowering the community and by promoting Rohingya leaders and human rights activists. You know, also like whoever donors and funding need to get directly to the Rohingya organizations, and Rohingya should be at the forefront line, not other people should be. And Rohingya been neglected many places. We have seen that in MOU signed Burmese government and UNDP and, you know, UNHCR. There is no Rohingya participation. Without Rohingya, they signed the MOU. So if Rohingyas are not participated at the core issue, how can this happen? So that's why this is very important. Bangladesh government also have to take on that issue very seriously, and international community too. And also, I want to point out here is we can see another problem. Same time, Rohingya boat, many people are fleeing by boat. So this is also one of the root cause of the ongoing genocide in Burma. And also Bangladesh side, people are not feeling safe, and there are many human traffickers and other things are going on. So Bangladesh government have to allow international community should support Bangladesh government, support not only humanitarian and other providing other resources to empower this community. Same time, Bangladesh government have to do the same. Thank you.
Thank you very much. So now we have an interesting question, and it's a general question to all of the panelists, and I'll flash it now, and anyone can jump in you feel like to answer, and after that I would invite Dr. Hilal Muhyiddin to discuss his points. So here is the question, and it was posed by Dr. A.K. Mazhar Islam from Bangladesh. He's a professor at one of the largest public universities in Bangladesh, and he has a lot of research interest with regard to Rohingya. I think Jessica mentioned a little bit about it in her part of the presentation as well, but feel free to jump in, anyone.
Yeah, I think the host community and the refugee populations, they have different needs, you know. And I think that right now the local people have been getting kind of a cut of the aid, but is that really what they need? I mean, aid can cause donor dependency, and maybe it's not even useful for the long-term goals of that community. So I think giving people in the local community access to having a voice, you know, about what the support that they need and how resources can partially be allocated to support them is really important. I think, yeah, one thing I didn't really touch on in my talk, I talked about remittances possibly drying up, but the other thing is humanitarian aid funding. I mean, we've already seen one big agency, Oxfam, made a big announcement a couple weeks ago, prompted by COVID, that they'd be scaling back their global programs quite a lot. that doesn't include their work in Bangladesh or the camps, but I think it's maybe a sign of what's to come from other agencies and globally. So far, the response has managed to raise enough funds, and that might be, there will be enough, I think, for, basics like basic food and hygiene and this kind of thing, sanitation. But, in order to create a rehabilitative environment, that requires skills training and capacity building and supporting refugees to make decisions about their lives, not only for while they're in the camps, but to prepare them to repatriate in a sustainable manner. Again, it's in Bangladesh's interest, I think, to help equip them to go back someday with the things that they need. So I think now is the time to kind of preemptively prepare for there to be less funding coming in to the camp, so that if and when that happens, the community is equipped. Both refugee and host communities are equipped and have, are ready to kind of make their own way and support themselves in a sustainable manner. So I don't know if anyone else, had any thoughts on that.
Thank you, Jessica. I was thinking that your presentation, as well as the your answers to this question, was exactly what I wanted to say, but in a much better and more eloquent ways. This question about the hatred or the tension between the local community and the refugee camps really made me think of this was the time that I went to the camps was my first time ever that I had actually visited the camps, and I'd always yearned to be there to really see firsthand what it was like. And it was a really, really empowering trip to be able to not only see how destitute the camps are, because there are already people talking about that, but I wanted to see the resilience. I wanted to see how things are with my own eyes. And one of the things that I saw, and I'm never going to forget about it, is that every single morning and every single afternoon, there are lineups of cars, vans and vans and vans of the humanitarian aid groups that go into Cox's Bazar, from Cox's Bazar into Ukiah and into the camps, the various camps that there are, mostly Kutupalong. And most of these vans would honk at local community or the tom-toms that are actually just doing the work in order to survive. Imagine that's going on for 3 years, and what it would do to your psyche just to hear that in the morning, just to listen to that, just to hear the driver who's from your nationality, because most of the hired vans are basically the drivers from the local community, and the local community honking at the local community because of the Rohingya. That in and of itself already created so much tension. I've heard so many Bangladeshi initiatives and people who work in, really, really close-knit with the Rohingya, with the sexual and gender-based violence survivor. They were talking about how children of the local community cannot cross the road in the morning and cannot come back home after they come from school. Like, this is already really troublesome. And I don't see that things are going to change anytime soon. I happen to sit in one of those vans just to get into the camps. It's horrible to think of it. And this is just one aspect, only one. There are a lot of other issues around, hate rhetoric that is being circulated from various different groups in Dhaka, in various different parts of Bangladesh. There are issues of deforestation and misinformation around, what Rohingya refugees are costing their environment. And Bangladesh is already volatile in terms of their global warming and climate change issues. And they're actually projected the country's projected to have to cause or to produce the climate refugee in a few years if things you know, go the same, if things continue to be in this, you know, in this manner. So those are many different, it's just so layered and so complicated, but you know, it's the environment that we foster, it's the environment that the humanitarian aid foster. In order to help one group, you're actually compromising the safety and the well-being of the other group, and that's not fair to anybody. It's not fair for the Rohingya to be hated. It's not fair for the Rohingya, for the local community to have to deal with this for how many years, we don't know. So that's just an example for you to kind of get a feel of what it's like on a daily basis in Ukiah, in Kutupalong, in these various areas. I think that I will echo Jessica in terms of, you know, her message on how things could be done in order to support the refugee community at this time and afterwards. I think that it would be important for, you know, you and many other audience, including us on the panel, to really speak with our representatives in our government, sending them letters or talking to them, talking to your members of parliament and whatnot, in order for them to really never take this issue off of the table, off of their, you know, off of their agenda, because that will affect how the fundings are delegated. In Canada, we have this global development funds. If the Rohingya issues, you know, changes or the priority of it change, we're probably going to see a decline of the funds that go into the camps as well. We're probably going to see less and less of, you know, Canadian-led efforts that would go to help the refugee communities. And I'm being totally pessimistic here because the international communities are so distracted most of the time. It's like, you know, a child with shiny things. If the next shiny thing's bigger, that's going to be the place that the child would go. So this is just, I'm sorry I'm using this example, but that's how it is, that's how it has been. So in order for them to keep this issue on their agenda and keep talking about it and keep making things better for the Rohingya, or keep improving the ways in which the international community deals with these issues, really need to come from you know, the local the people who live in those respective countries, and you know, really try and think a little bit more carefully. If you think about donating, really think carefully on who you want to give the money to, and try to look at their the percentage of the overhead. There are many Rohingya-led or, you know, Bangladeshi-led efforts that are really useful and powerful, and they oftentimes have a lot less overhead and a lot more direct, you know, directly involved with the refugees who are working for them, or who are, you know, delegated to, you know, to basically distribute the funds or distribute the goods or the necessities. I happen to work with a few of the Rohingya youth who are, you know, happy enough to actually pack up a COVID-19 kits for the Rohingya refugees, and these are frontline workers. Yeah, so they go and not only educate the Rohingya refugee community about how to protect themselves from COVID-19, and how, you know, educating them on what it looks like and how it's going to affect their health, and then give the kits to these people in order for them to be better equipped. And this is entirely led by the Rohingya. They do not take a dime from, you know, from the efforts itself. And I was fortunate enough to be able to connect with these people when I was there. So it would be really important. And the other person that would be that would have been so great to talk about this issue is raised. Unfortunately, due to the technical difficulty, he wasn't able to touch upon the Rohingya Children's Project, where there are so many schools that are run at the camps. There are many different efforts. There are tailoring, training courses that is ongoing in the camps right now. Although there's a lockdown, this all is done by us outside, or some of the Rohingya who are a little bit more mobile within the Cox's Bazar area or Kutupalong. So they are the core, and I think they play a really, really important role in actually helping the management of this COVID-19. And so I feel that during COVID-19 or beyond this, we really, really need to not just look at the civil societies or these different humanitarian aid efforts that are not just big NGOs, big humanitarian groups, but looking at funding, those who are actually working on the ground, understanding the issue firsthand, and allowing them to be able to lead those efforts, so that it's a lot more responsive and a lot more beneficial, and hopefully that the funds that we provide, or the funds that is donated, are not going to be lost in the process. Thank you.
Thank you very much, Jessica. I would invite Dr. Hilal Mahyuddin to jump in here and share his perspective. As I said, he was one of the co-authors of the book, and he teaches from Bangladesh. He has a very close perspective on this matter. And just to be conscious of time, after Dr. Hilal finishes, and I'm requesting him to kindly wrap up within 5 minutes or so, then we'll take only 2 questions from the audience. And as I say, just to be conscious about time. Thank you. Dr. Hilal, the floor is yours.
Okay, let me thank all the panelists. Dr. Kausar, I have just something very pointed and very focused to discuss with everyone. This is about COVID-19. The situation is getting worse every day, that's for sure. The thing is that Bangladesh is a poor country, and I have been watching everything very closely, talking with many people who are working there, even different humanitarian organizations and international organizations as well. Almost every day basis communications are taking place here, and I am part of it to some extent, whatever I can manage during this time. So my impression is that being a problem stricken country itself, Bangladesh is doing very good job in terms of managing everything. It's just common perception everywhere in Dhaka, in Bangladesh, in Cox's Bazar, and other places that Bangladesh can't really do any more than that. So Bangladesh part, even donor organizations and international organizations, government people and others are very happy about that, that okay, these people are trying their best. They can't go any beyond there, any more than that. At the same time, UNICEF has different programs like education programs. That's not that bad. BRAC was there, very extensively involved. It's just common understanding of common people and common researchers who are working there still now, that okay, these programs are really making some differences. And now Rohingyas who are there, they are very much familiar with many different terms like wash, water and sanitations, then health, hygiene, maternity, child health, family planning, many other things. So they are very conscious at this moment. So all these spillover effects and trickle down effects are also there, even if they are trickling down and these people are getting all these benefits. On the part of the international organizations, still people are very satisfied that they're trying their best. Like, okay, when the country is suffering with no ICU, not enough number of ICU and PCI, there are 2 PCIs and 1 more PCI will be coming very soon. There are 3,000 at present, probably there are 300. Okay, isolation units are ready by now, and it is going to be 2,000 very soon. And there is a proposal that it would be 3,000. So on the part of the government and international organization, we can't just blame them in a wholesale manner that they are not working or they are not doing in a proper way or other things. So this is it. How local people are perceiving. We know that this tension is not very unusual thing. It takes everywhere in the world. Local people and the host community people and the refugee people always get into some sort of tensions at some point. So it is a very common thing. And in Bangladesh, it is not at that unmanageable level. Actually, I am trying to tell you, share with you all the information that people, experts are thinking, even the researchers, independent researchers from different universities. So these are impartial sort of reflection in that way. So that in that respect, what's the main problem at this moment? COVID. By now, one Rohingya person is already dead, right? On okay, 2 or 3 days ago. Now there are 35 confirmed infected Rohingya refugees. It will spread very soon. Just maybe about 6-7 hours ago, a news report is published from, I believe, I don't know the source of where it is from India or somewhere else. So it is saying that a ticking time bomb explodes as Bangladesh declares Rohingya refugee camps in Cox's Bazar a COVID-19 red zone. Do you see? I did not really get this news before. When I was surfing internet, I got this information, very latest information. So I will have to check whether this is true or not. But the thing is that there are some propaganda as well, and many other things are going on around. We have to check before what we say. So what is the problem on the part of the some people, some complaints and others that, okay, I am sharing with you some of the insights of most people that a human rights approach, that's very good. No one is really going to debate against that or refute that claim that we have to focus on that. But leadership is a big crisis. They are pointing out that in the Rohingya camps, even the Rohingyas, they are divided into different groups and subgroups. So many groups that it would be very difficult to make them sit for a solution or to resolve some problems or to make a decision. It is going to be a big challenge. Now, their main focus is COVID control, corona control, and during this time, probably they cannot do it because this is not the right time. At the same time, they are blaming international human rights advocates and activists like those who are in Canada and who are here and there everywhere, that okay, these people are talking big all the time. They're blaming them, this and that, India here and there. Why are not they coming up with some concrete, very concrete programs and at the same time, mobilizing money, generating money and funds? Like Canadian government has $300 million and government doesn't know where to fund it, how to fund it, through the government or through the human rights organizations or the international organizations or others. So there are a lot of confusions about that. Okay, Canada has already allotted $300 million. Why they are not disbursing this amount? Why they are holding it back? What is the reason? And what are the international diaspora communities and international human rights organizations, especially activists, are doing that? Why don't they influence the policy like Canadian policy and Canadian government? So these are some of the very, kind of impartial reflections from different communities and different researchers and others, that okay, if you can bring something from Canada like $300 million that Canada has pledged, then come up with a specific program and influence that policy in Canada if you are really serious about their human rights and other things, rather than just talking big and other things. And so I am sharing with you all these perceptions that people are having these days. They are not really very satisfied with us making very straightforward and very generalized comments that these people are in. Everyone actually appreciates that. That okay, they are in big problems. They are waiting for repatriation. At the same time, they are human rights, and they need to be, they deserve to be respected as human beings like everyone else. They need to be empowered. No one, I don't see actually a reservation in people about that, that okay, we support their livelihood type of stripes and plannings at the same time human rights and all other things. But the thing is that now you have to work more closely to get a very practical sort of solution, small solutions that government can take into consideration and share with others. Because people's common perception is that in that area, at least it's a different. There, people are trying to do really to make a big change. Not that okay, we can they are not trying, or they are wasting too much money for other things. If they are not paid well, they will not work there. But when they are working there, of course there are some changes, and they're living some sort of things. And so they are asking us again and again that you have an organization in Canada, you have different universities there, so try to reflect more positively, with positive focus and with some practical insights, just not straightforward, generalized, over generalized, blaming this and that international organizations or Bangladesh governments and others. Thank you.
Thank you very much. I would like to bring Khin here because I know he visited Canada a couple of times and he met with Bob Ray, Honorable Bob Ray, and he spoke even in the Parliament. Khin, what do you see based on Dr. Hilal's statement? How to really evaluate Canada's response so far? Unmute the mic.
Yeah, I can speak, but it will be much better because the Canadian activist is there. She got also much better context. But my view is we appreciate Canada initiative. Canada being on top of the humanitarian issues, and even when we talk about justice and accountability issues, Canada and Netherlands is the only two countries who are supporting Gambia case. That is very good. The way how Canada been doing, and of course, like especially appreciate Bob Ray been doing a great job, but I don't think the real action, the reality of how Rohingya been suffering in camps and about justice and accountability, that they are doing much enough. That need to be done much more, especially Canada have supported many funds. It is important. We have Canadian Rohingya community there, organization there, and from the Bangladesh side, there is many Rohingya survivors in the camp that Canada should be able to do much more to support empowering Rohingya community. That one part needed. Of course, humanitarian aid and others they're doing, but still they need to do much about empowering community is much needed, because we have Rohingya organizations. As Brother Halal mentioned, there is some organization that is because of the Rohingya been victims of genocide for many decades. So Burmese government and military systematically destroyed us. So there is a lot of some psychological, mental issues and others because of in community there have been some, fractions and those things, because that is the way how Burmese government and military did already to this community. No matter how, we have to face that, we have to challenge, we have to move forward. On that side, when we move forward, we need international community help, like Canada. I suggest some, diplomats and also who are really working on this issue, Canada and other countries. Why Rohingya activists and representatives, they are not sitting down with them? Why if they can sit down with Bangladesh government, if they can sit down with others, why not there is not such a meeting? Last year, our organization, we had a Rohingya youth conference. We organized it as a Rohingya. But if any governments have willing, they should support that, those kind of conference and meetings. To do that fundings are needed, to organize all the Rohingya activists, all the Rohingya youth activists and leaders. And there are many Rohingya around the world who are interested, but the fundings not going to the Rohingya diaspora or Rohingya camp leaders and activists inside the camp. So this is very important that governments have to deal also. We are neglected, one after another, in a government side, and even, there are some organizations, they talking Rohingya issue without Rohingya representation. That's I can talk. So those are the things going on. Ignorance and neglecting is many issues. So I believe that that is one of the strategic Canadian government have to, like a Bopri or whoever leading that, is why not they meeting up Rohingya activists and leaders, diaspora, and a kind of what can be their strategy to push. And those kind of things are needed to discuss Rohingya, a group of activists or representatives. Of course, there are some Rohingya because we are here, UK, some are in Canada, some are in United States. There are some organizations, but they should know who are working really on the cause and sincerely bring them up and just draw their strategy, what we want, what Rohingya want, what can be done from international side. That kind of strategy meetings are really important. I mean, of course, they're dealing with UNHCR, Bangladesh government, and discussing issues. But sometimes I can see that some governments are really afraid of us when we talk directly. So now ICJ actions, not listening, ICJ provisional measures are not going, it's not implementing. What is next? Your action. And the government, when we ask that, they're really afraid of that, those kind of questions they don't want to face. So we need to have some real practical action and practical talk. That is very needed. I appreciate Brother Halal mentioned a really important point. So same time, it needs to be done from many different sides. That is my view. Thank you.
Thank you very much, Khin. Again, just to be conscious of time, so I'll pose two questions to Yasmin and Olney, which I received from the audience. I think both are very important. So just I would request you to briefly comment on that so that we can wrap up in time. So the first question goes to Yasmin, and it is here. And if you're okay with the question, Yasmin, then I will switch to second question for Jessica, and this is here. And we discussed a little bit why the dialogue is important during this time. So whoever wants to go first, Yasmin or Jessica, you are welcome.
So it's a very, very complicated question, and I really, really appreciate it being asked. The one problem that we all were kind of trained or taught when we start taking political science courses is that nation states are only obsessed or interested in their own self-interest. Keeping that in mind, things are not going to move fast, or things are not going to change very drastically when a war crime or a genocide take place, because it comes with a strings of issues. And those issues that we actually talked about earlier, and these are not just it's not just this. There's so many more, and it would take us 3 days to actually talk about all of the issues and probably more. The one thing about the UN agency working in, especially UNHCR working in different states that actually did not sign on to the Refugee Convention, is that they are only working at the mercy of the nation state, the government of that respective nation states. And so with the Bangladesh not being the signatory to the Refugee Convention, it is it's that much harder for the UNHCR or any other UN agencies or international community in general to influence the decisions that are made in terms of humanitarian efforts or repatriation or any sort of initiatives that are being taken at the camps. Now, with that in mind, even though this is a very urgent issue, as the ICJ, the International Court of Justice, the president had read out the order, and he said this is a very urgent issue, and because there are lives that are at stake, it needs to be addressed as soon as possible. The wheel of the international justice, or the wheel of the international communities, are still turning very, very slowly, because it's a huge bureaucratic entity. And so there's so many different loops and holes that you would have to go through in order to address one simple issue. So it is, I'm also not saying that there is you know, a demotivation or an incentive not to do anything, but I think that it's a very complicated mechanism altogether that actually makes it harder for this sort of issue to be addressed in time and in a timely manner. So I'm hoping that the more we push, the more we work on the issues, and like Brother Hilal was talking about, how we need to talk about, you know, issues of funding and whatnot with various governments, and because at the Rohingya Human Rights Network, and Brother Rais would be able to talk more about that, because he's had many meetings with global affairs and global development agencies, and all of this was done in order to guide and clarify for the Canadian government more on where to invest their funds and what kind of programming should they look at. But it's still this little bit of trust issues that I think the Canadian governments or any governments would have in order to invest in a more grassroots efforts, because they really want to have, you know, a lot of evidence or a lot of things to show, even though they're not very different in how, you know, how necessities, or like on a very rudimentary level, when things are distributed or food are distributed, or, you know, necessities are being provided, it is the same, and maybe less costly with the grassroots organizations, but it's just the namesake and the big powerful organization that have a lot more sway in order to work and exist in, you know, various different areas, specifically in the refugee camps. And so governments tend to actually fund those projects and programs better. So there still needs to be a lot more push, and it should not just come from Rohingya like me, because I think they're tired of hearing from us because we have so much to lose. It's probably much better coming from concerned citizens, and it should be addressed, you know, to your respective members of parliament, representatives who might have a lot more empathy and compassion toward the issue. Thank you.
Thank you, Yasmin, for this very candid answer. So here I would like to share with the broader audience what Rais just shared with us, and I just quote him directly here. So Mr. Rais from Ottawa is saying that those who are attending CRRIC's webinar, here is what he has to add. So I'm quoting him directly. So he's saying to focus exclusively on the topic of the webinar, COVID, and to narrow down the focus on my people living on the west side of Naf River at the refugee camps in Bangladesh. Brothers and sisters attending webinar, I would like to stress the importance of Bangladeshi government to continue its support and solidarity with my people, especially during this critical moment of COVID crisis. We all know of the big challenges that we face at the camps and host communities in light of COVID. There are no ICU units, there are barely any ventilators, very few isolation beds, and testing is not everyone's disposal. Camp population barely has its much needed PPE, let alone basic necessities such as clean water, soap, and on top of all these, the internet ban is still in full effect. So my request to our audience in this discussion, some of who I believe have a certain degree of influence on some levels of Bangladeshi government, is to utilize your influence to a push for universal testing and treatment among the inhabitants of the camps and the host communities, and be advocate to channel resources towards augmentation of COVID essential healthcare facilities such as building IC units, supplying ventilators, setting up of 10 centers, advocate equally to channel resources towards supplying clean water, PPE, and personal hygiene. And finally, to push for a lift of internet blackout, at least for the sake of access to life-saving information for people living inside the camp. The news that there is only one death due to COVID at the camps is a massive misrepresentation that could not even be logically true, seeing that we have 63,000 cases in Bangladesh with nearly 850 deaths. It shows that there is indeed lack of information sharing, and that is exclusively due to the internet blackout, I unquote. So these are the written portion of Mr. Rice's statement today, and I share broadly with the audience. So we are in the very last stage. I would briefly request Jessica to comment on this question that we received from the audience, and then I will wrap up the today's webinar. Jessica.
Thank you. You know, I'm in the U.S. and the U.S. you know has had the biggest COVID outbreak in the world. So I know that my government could have handled things much better, and I'm sure that everywhere, you know, there have been mistakes made. But according to the Bangladeshi friends that I've been speaking with, the government has done their best. And the question of you know, withdrawing humanitarian workers from the camps, I think, you know, it's not necessarily unreasonable. You know, they probably bought some time for the facilities and isolation units to be set up and preventing the virus from getting into the camp, at least for a while, although everyone knew that it was probably inevitable. So, you know, I think I think that there's a lot of understanding there, and of course, it's a really difficult time. And government, scientists, no one really knows exactly how to deal with COVID. So, yes, I agree that having internet access would be helpful. Although even before the internet blackout, a lot of parts of the camp did not have a good signal. So this is a broader issue that does need to be addressed. So the question about repatriation in the time of COVID, my understanding is that Myanmar has said that during COVID, they're temporarily not going to allow formal repatriation back. Of course, most people are waiting for rights and justice anyway. So I'm not really sure beyond that the direct impact of COVID on repatriation, because repatriation is currently premature for many reasons. In terms of Black Lives Matter and the Rohingya crisis, well, I'm a white American. It's time for white people to be quiet and listen and learn. And I can only say, you know, so I cannot speak for Rohingya or Black Lives Matter, but I would just say that any mass moment, mass uprising that causes a large segment of society to reflect on continuing systemic injustices and racism, that can be helpful for the Rohingya issue, as well as you know, Black Americans and others around the world. So the focus of the moment in my country and much of the world right now very much has to be on the systemic injustices and police brutality that Black Americans continue to suffer at disproportionately high rates. But this in turn can also just put other issues of justice on people's radar. So perhaps one of my colleagues has something else to say about that, but I know like Khin, for example, and Yasmin, Ullah, we're posting on Facebook, you know, messages of solidarity and support, which, you know, I think is a really powerful thing for people to see.
Thank you very much, Jessica. So we would like to wrap up today's webinar. Thank you very much. Before we go, we just always request our panelists to have a last words, just a couple of sentences. So we'd like to hear from Khin first, then Yasmin second, and Jessica lastly. What are your last words to our audience about this issue?
For me, my last word is, it is a 21st century. We are a community facing genocide. And genocide is continuing even until today. So it is important that when we can see same time Black Lives Matter in US and other countries protest. So one community is facing same like how Nazi Germany did the same. So we really want justice. We want to continue our efforts, and it's not only for the government, all the people, it's about all individual government will stand up to stop the genocide. That's my point.
Thank you. Yasmin, now, please. Your last words.
Thank you so much. I just want to reiterate the things that I said in a very, very short sentence, or maybe a few short sentences, that surviving a genocide takes a skill, and those kind of skills can be polished, can be built on, in order for for the people who survived the genocide to have a more efficient role within the community, within the larger society. And it is incumbent upon the international community, and not just NGOs or big agencies or various different government agencies. It's incumbent upon us to be able to support and encourage and empower them however we can, so that 10 years from now, 20 years from now, they won't just be refugees. They won't just be survivors of genocide. They will become much more than that. And that's what I really, really hope for all of us to take away from this, is that they have already done the work that was cut out for them to survive a genocide, to survive someone brutally killing and wiping them off of this planet Earth. We now have a role in whatever ways we can. You can help monetarily, you can help in other ways too. There are various things that you could do, and please reach out to any of us if you're confused or if you have any question. But do remember that without all of your help, we will not be able to see that community flourish at all. Thank you.
Yeah.
Yes, Jessica, please.
Yeah, thank you. I work with the survivors of genocide. They've become my friends over the years in the camp, and they're still there. They still have hope for their children's future. They still have hope for justice. Sometimes we hear international observers really cynically saying, "Don't be there forever," something like that. It's not acceptable, People are trying to rebuild their lives. Families are trying to rebuild their livelihoods. And we have to look at this as an ongoing, very live issue. And we can't afford to forget that survivors still need a lot of support and solutions. So we can't be nihilistic or fatalistic. There's no way to make progress on the issue. We've heard today about a lot of justice and humanitarian and political, initiatives and needs, and we have to keep working on those.
Thank you so much. And from Rice's perspective, again, I'm quoting, he would like to thank, he says that our Bangladeshi brothers and sisters who have always demonstrated unfettered solidarity with my people for the last 4 decades since we fled our homes in large numbers during the first wave of massacre in 78 Operation Nagamin, to form what is now known as Noya Para, only to be followed by more and more camps. We need this continued solidarity to go through the difficult times of today. Your solidarity is greatly appreciated, and only Allah Ta'ala will reward you for it, inshallah, I unquote. So this was the last word for Mr. Rice. Thank you, dear panelists, for holding on for last almost 2 hours, and there are some glitches in between. I must appreciate your energy, and Khin joining from all the way across Atlantic, and Jessica from mainland USA. and Yasmin, and Dr. Aliya left because she could only stay for 1 hour. She has a very busy schedule as a doctor, and Rais joining through texting. And before I really leave you guys, I just wanted to share with you what CRRIC is doing so far. Beside the academic work of raising awareness amongst the policymakers and all, we have just secured a small funding from MCIC, Manitoba International Council here, of a very small fund to provide some education in the camps. And as some of you might know, visiting from our website, our target is adolescent Rohingya women mostly, and also some men in the camps. So we have just received, and we are very proud to utilize that fund. We are in touch with some of the NGOs down in the, but I don't know, once the restriction is lifted, we'll be implementing that one. And also as a follow-up, we have already, I would say, almost secured a 60,000 US dollar fund from Rotary International, from my club, and it's called Global Grant. And we have not got the final confirmation as yet, but we have mobilized a lot of Rotary clubs in the USA and elsewhere to support this project, and successfully we have done that. Now we are just awaiting last part to be confirmed from the Rotary regional office, so that we can go ahead with this funding. And it is also educating the Rohingya adolescents in the camps. So these are the two major things we are going to do, hopefully in the months to come, when the COVID things little subsides. And beside that, we are also partnering with universities and academia in Bangladesh to raise awareness, so that hatred, host communities' reaction to our brothers and sisters in the camps can be addressed in a more meaningful way. And lastly, I will leave you with this hope that being a very small organization in the middle of the prairies, we are doing our best, and Rohingya brothers and sisters are in our minds and hearts, and we'll do as we move forward. Once again, thank you very much. Have a beautiful rest of the day wherever you are. Stay safe, and we'll again meet in the near future. Thank you.
Thank you very much.
Thank you.
Assalamu alaikum.
Thank you, everyone. Then have a good day, everyone.
Thank you.
Take care. Stay safe.
Thank you.
Thank you. Take care.